Hey guys, Dr. Kaylee here, pelvic floor physical therapist, owner, founder of Fem Empowerment and Advocacy, creator of Leap No More, Core Upgrade, and all kinds of cool things. I wanted to hop on and just answer a couple questions now that many of us are actually like scrolling through for information, but we have a little bit more time to just educate each other and give each other more information so that you know what you're dealing with. And a lot of people ask me legit, like I get messages daily, like what the heck is my pelvic floor? And so I want to tell you first and foremost, it literally is not only what we're dealing with as far as like vagina. It is and does include your bowels. It includes your bladder. For me personally, my own definition is anything that affects the function of the pelvic floor. So the pelvic floor itself is, yes, like the pelvis, and then we've got the pelvic floor musculature. We've got two layers of muscles, deep layer and then also superficial layer, which is where that vagina is, but it's also vulva, better terminology, but it's also including the organs that are inside the pelvic floor. So the bowels, the bladder, the diaphragm, I include that in a lot of my treatments. It includes the low back and the spine. It includes the hips. It includes the pubic bone, because there's a lot of things that can occur in the pelvis or in the pelvic region that can affect the function of your pelvic floor. So I always tell people it's not just your vagina, it's not just your vulva, it's not just that type of thing, and it's not only internal treatment. Your pelvic floor includes all of those things that I had mentioned just before. And I like to tell people, you know, you think about your hips, you think about your pelvis, you have your pubic symphysis right here. But if you turn this around, you can actually see how closely connected that pelvic floor is to the spine and the sacrum. Sorry, I'm dropping my bladder and my rectum out of my model here. But you can see how close that the spine is to the sacrum. You can see the tailbone here. You can see that this is the SI joint. A lot of my runners have pain, clicking, things like that here in that sacroiliac joint. And you can see how closely connected that is to the pelvic floor. So we can't just treat the muscles around the vagina or the vulva. And I mentioned this on my Instagram, but remember, like, all of this is your vulva. Your vagina is just the opening here. You know, pelvic floor also includes the clitoris. It includes the superficial muscles. It includes the deep muscles. It includes the pubic symphysis during pregnancy, pubic symphysis dysfunction, postpartum pubic symphysis pain, separation, labral tears, hip tears, low back pain, all of that. That is what pelvic floor is. And to me, a treatment of that, I have to assess the low back. I have to assess the pelvic floor. I have to assess and ask you questions about your bowel and bladder. Those can include, have you experienced leakage ever in your life? Are you experiencing leakage currently, urinary leakage, or even bowel leakage? Fecal leakage is a real thing too. And you want to make sure that you're seeing a provider that's asking you all of those questions, because again, the pelvic floor, like I said, it includes all of this, but it also includes your low back and your hips. So if we're not asking about hip pain, low back pain, SI joint pain, or anything like that, we're missing a lot of that aspect. We also have to assess and look at your breathing and make sure that you're breathing well. How does your core function? That's one thing I didn't mention earlier. Your core strength and endurance is really important to pelvic floor. They have to work together. And to be able to have a good, strong core will help you in athletics and help you get back to the gym and do the things that you want to do. So that's kind of my answer. I know like that's a lot of information for a question of what is the pelvic floor, but it really is more than just your vagina or your vulva. It is the whole thing. So when you're thinking of, do I have pelvic floor dysfunction or do I have an issue? A lot of clients automatically go to, oh, well, I'm not leaking, so I'm fine. Or, oh, I don't have pain with sex, so I'm fine. But it's more than that. Can you connect to your pelvic floor? After having your baby, did you completely disconnect like your emotions and your mindset? Are you even looking at your vagina? Are you looking at your vulva? Are you paying attention to those parts of your body? Because those things are so important as a female. And I grew up in a household where we didn't talk about this much. Also in a culture where if you said vulva, vagina, or whatever, I think I called it my hoo-ha, by the way, but you didn't talk about it and you never told anybody that you had any issues with it. And so here I am on a Facebook Live telling you that we need to be talking about it, because there's a lot of things that can contribute to pelvic floor dysfunction, but a lot of things that need to be assessed in order to make sure that it's functioning properly as well, which includes breathing and core strength and hips and low back and all of that. So that's kind of like my rundown answer to what is pelvic floor. And then if you want to transition that into what is pelvic floor physical therapy, it's really just the treatment of all of the above that I just mentioned. I see clients that don't have symptoms and don't have pain, but they want to prepare for labor and delivery. I see clients who want to prevent any issues during the delivery of their baby. I see clients who are postpartum and they want to get back into the gym, but they really don't know how to scale, or they don't know how to properly move without having a symptom or without contributing or causing a symptom. I see a lot of women who are trying to conceive and they want to start to talk about how to have a baby and things like that, and they want to make sure they don't have pelvic floor dysfunction. There's a lot of things that we can cover in pelvic floor PT, and that's why this week I'm kind of dedicating every single day to come live at some point and talk about some portion of that, because I think it's just important for you all to understand that you can ask me questions, but also there is a lot of difference between each individual. You shouldn't be getting the same treatment every time you see a clinician. You shouldn't be going to one clinician and then see a telehealth consult and get different advice. So make sure that you're paying attention to those things. But if you have any questions at all about what is pelvic floor PT, or what is your pelvic floor, or what is pelvic health, please let me know. Drop your questions below or ask me via message, and I'd love to answer those. But again, if you have any answer or questions that you want me to answer throughout any of these days, let me know. I currently have a list of like 15. So you're going to be seeing a lot of me, but it's been a while since I've done lives, so I'm excited to come on. But anyways, let me know if you have any questions that you want me to answer. Please, again, stay home. I know you hear this all the time. Let's flatten that curve together. Let's get the education that we've always desired, and let's get the information that we really want now while we have the ability to communicate so well online. Like, thank goodness for technology, right? Anyways, I'll see you guys later.